What is the golden hour in first aid? Have you ever heard the term golden hour in the context of first aid? It refers to the first 60 minutes after a serious injury or trauma. This time frame is incredibly important for increasing survival chances and reducing long-term complications. Let's break down what this means, especially for those of you who enjoy hiking. When you are out on a hiking trail, injuries can happen. Whether it is a fall, a sprain, or something more serious, knowing how to act quickly is vital. The golden hour emphasizes the need for rapid assessment and intervention. This means you should quickly evaluate the injured person to identify any life-threatening conditions. Look for signs like blocked airways, severe bleeding, or shock. First, ensure that the injured hiker can breathe properly. If their airway is blocked, clear it immediately. If they are not breathing, be prepared to give rescue breaths or perform cardiopulmonary resuscitation. This is where your first aid training comes in handy. Next, controlling bleeding is essential. Apply direct pressure to any wounds to prevent excessive blood loss. If the bleeding is severe, you may need to use a clean cloth or bandage to apply pressure. Remember, excessive blood loss can lead to shock, which is a life-threatening condition. Stabilizing injuries is another key step. If you suspect a fracture or spinal injury, immobilize the affected area. This helps prevent further harm while you prepare for evacuation. In the outdoors, you also need to think about temperature. Hypothermia can worsen an injured person's condition. Protect them from exposure to cold by using extra clothing or blankets if available. Once you have provided initial care, it is crucial to seek emergency help. Use a mobile phone, satellite communicator, or an emergency beacon to call for rescue. The sooner help is on the way, the better. The concept of the golden hour comes from trauma care research. Studies show that survival rates improve significantly when critical care is delivered within the first hour after injury. While some may debate the strict 1-hour limit, the main idea is clear. Earlier intervention leads to better outcomes. For hikers, this means being prepared. Carry basic first aid supplies and know how to use them. Recognizing signs of serious injury and acting quickly can make all the difference. Even if it takes longer than an hour to get to a hospital, stabilizing the injured person during this time is vital. In summary, the golden hour in first aid is the essential window right after an injury. Timely and appropriate care can prevent death or serious complications. For hikers, understanding and applying this concept is fundamental to effective wilderness first aid.